A stroke can change your life in an instant, but the right care can change the outcome.
Yeah, and UC Health experts are pioneering treatments and research to give stroke survivors a second chance.
Today, we're hearing from a survivor and the team that's making a difference every day.
So the day of my stroke, I was supposed to be downstairs and be at work, and my husband came upstairs to check on me, and he noticed that I was not fully aware. I sat up on the edge of the bed, and my balance was really off, and he realized that my speech was really slurred. So he called our family doctor, and she told my husband to take me to the nearest hospital. And then they transferred me to UC Health.
The UC Health stroke program is involved in a patient's care from the moment they hit the emergency room. From there, patients are in the UC Health system and will be treated in the hospital by stroke-trained physicians. Then we will follow up with you in the outpatient setting, whether that is to continue the clinical care and also to explore new treatments for stroke recovery.
We are involved in research and advancing medical care. We will continue to push the envelope of developing better and better therapies, better treatments to prevent stroke, or better strategies to prevent stroke, the cutting-edge research opportunities. I'm really excited about the prospects of brain-computer interface, for example, in stroke rehabilitation as well. Those are the things that we're going to hear about 10, 15 years from now.
I was in 2 studies. I was in the cognitive study, and then I was in the study between what blood thinner worked best to prevent another stroke from occurring. It was an amazing study because it looked at the large majority of the population of people like me who had an ischemic or a blood clot stroke.
What I'm also most excited about is, as a field, we're really paying attention on who we are developing these therapies for, making sure we develop them for as many patients as are eligible for them, and we leave no one behind.
I have seen patients go from coming in unable to speak, unable to use half their body, been able to introduce reperfusion therapy where we open up the artery that feeds the brain and reverse those changes, where they're able to walk out of the hospital. At UC Health, our stroke team is made up of vascular neurologists, emergency medicine doctors, and neurocritical care doctors who all work together for our patients from the very acute period all the way through stroke rehabilitation, which means we can see the patients as a whole and see their care out from the very beginning through the very end. And if I were a patient who's had a stroke, that would be something that's important to me.
UC Health provided for me the hope of a lifelong event, that I could live life to its fullest, that I didn't have to worry about having another stroke, to be hopeful for my future.